Namaskar and a very warm welcome to this edition of Let's Talk Health. We talk of gastro queries today. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID-19 vaccination coverage exceeds 190 crores today. India reported 3,207 new COVID cases, more than 13 lakh vaccine doses administered in the last 24 hours, and the recovery rate currently stands at 98.74%. Well, as COVID-19 continues to worry us across the globe, COVID-related queries are on the go. People are speculating about various complications in health. Well, in this program, friends, where we take your questions from Facebook and YouTube Live, we are today joined by Dr. Srikant Gopi, Assistant Professor, Gastrology, All India Institute of Medical Sciences, New Delhi. Many thanks for joining us today, sir. My first
Thank you.
question to you, Doctor. Welcome to India Science. Please tell our viewers about the current gastrological scenario in India in view of the XE variant and the new strains. How do you kind of prioritize gastro management at such times? Is there any specific protocol that you may like to share with our viewers?
Sure. Good afternoon, all the viewers. The XE variant is not a different one from the previous Omicron variant. It's a mutation in the previous Omicron variant leading to the XE variant. The name may be somewhat alarming, but there is nothing to be more alarming about it. Okay, so the COVID appropriate behaviors that we are taking previously, like mask and ensuring adequate vaccination, would be sufficient. Because of this variant or existing COVID, there is no need to change our protocols in the management of the gastrointestinal disorders currently. So the management remains the same like previous to COVID era. And also the COVID variant new XE, they are like the recovery rate is very good and there is nothing much to worry. So just I advise all the people to continue their COVID appropriate behavior and also seek the medical help whenever there has some issue.
Right, doctor. What are the common symptoms now that we may see in gastrointestinal disorders? The common symptoms, if you could share some insights on common gastro symptoms, sir.
Okay, so before knowing what are the symptoms of gastrointestinal disorders, let us know what is normal function of gastrointestinal diseases. So we have a gallon esophagus, that is the food pipe, then the stomach, then the intestine, and apart from that you have liver, gallbladder, and pancreas. So you take the normal digestion process. Whether you need to know whether you are able to swallow the food normally, then food is being digested, or intake of food is causing any discomfort to you in the abdomen, or whether what is your stool frequency, whether you are able to pass your stool normally like your previous thing, and is there any abdominal pain, and coming to liver or gallbladder, is there any jaundice, that is yellowish discoloration of eyes, any loss of appetite, any inappropriate weight loss, any pain abdomen, and any increase in stool frequency. In this way, these symptoms can be these are the common symptoms that we see in OPD, in gastrointestinal OPD.
Right, doctor. We have a question now on YouTube, and this comes from Ananya from Noida, and she wants to know what is endoscopy. If you could please explain to our viewers, and when is it done?
Okay. Endoscopy is one of the procedure commonly done in gastroenterology departments. So endoscopy, like for example, with our eyes, will be able to see the patient outside, what is happening to the outside of the patient. But in gastrointestinal disease, we will be interested to know, whenever there is an indication, we will be interested to know what is happening inside the stomach, inside the esophagus, and inside the intestine. So is there any pathology that is causing symptoms? In such a case, we will do endoscopy. How it will be like? An endoscopy is like a long tube, okay, a thin long tube, in, through which there is a camera fixed at the end of the tube, and it is a flexible tube. It's not a rigid one. So the patient will be sedated adequately. Then endoscopy, like the long flexible tube, will be put through mouth, into the esophagus, then into the stomach, and then into duodenum, that is first part of the small intestine, and we will see whether is there any pathology that can explain the disease. It is called upper GI endoscopy because we do it from the upside. So second is commonly done is colonoscopy, also called lower GI endoscopy, where similar endoscope is used to evaluate the large bowel. Here again the patient will be sedated adequately, and if long flexible tube will be inserted through anal canal into the large intestine, and we will look for any pathology there. So this helps a lot to diagnose a disease and also treat some diseases.
Right, doctor. Another question that is coming to my mind now is for the viewers again. If you have pain in the abdomen, dark stool, heartburn, difficulty in swallowing, loss of appetite or weight loss, iron deficiency, does it indicate any kind of a problem?
Yeah, this is important thing. Any of these symptoms, like these have to be evaluated immediately. The like patient should not, or a person should not ignore any of these symptoms. For example, there is a common terminology among the public that they have some gas problem, some acid problem. So, eh, the symptoms which you have enumerated in any, like anemia, which may be manifested by easy
Yeah,
fatigability
YouTube.
or palpitations, or second, any pain abdomen, third, any involuntary weight loss,
नहीं,
fourth, any loss of appetite,
YouTube.
any history of blood in vomitus, or any black colored stool. These have to be taken seriously by a person, and he need to approach the nearest physician to evaluate further, so that you can diagnose a disease
YouTube.
early and the treatment can be done adequately. So what can cause these symptoms? There are n number of causes. The common causes one need to know is, commonest cause is peptic ulcer disease. Any ulcer in the intestine, stomach, can cause bleeding from that ulcer, and it can cause these symptoms. And second, malignancy, like cancer of the any intestinal tract, can cause these symptoms. So if a person has any of these symptoms, he has to approach the nearest physician for further evaluation, but should never be ignored.
Right. Doctor, we have a question from Ramakrishna Karan. And firstly, he wants to know about acid reflux and what are the first signs of liver damage from alcohol. Uh, Again, this question comes to us from one of the viewers.
So let's come to acid reflux. So this is one of the commonest cause for going meeting a gastroenterologist. So acid reflux. So let us know the normal physiology. Is acid produced in all? Yes. Every person for a healthy life needs to produce acid in the stomach. But so whenever you take a food, it goes through the food pipe into the stomach, and in the stomach the food mixes with the acid for digestion, and also this acid decrease your any infective load that may go into the stomach through the food. So the nature has produced a wall called gastroesophageal wall, that is wall between stomach and food pipe, so that the acid doesn't go back from stomach into the food pipe. By any chance this valve is defective, then the acid produced in the stomach will go back into the food pipe, and it causes acid reflux. So, what are the symptoms of this acid reflux? First point, the patient will be having a chest burning sensation in the chest, especially after food intake, and there will be sensation of reflex of food, or of reflex of acid into the mouth, causing bitterness in the mouth. So, second, these can be associated with sometimes associated with the epigastric pain. These are typical presentations of acid reflux. There are some atypical presentations. Like rarely, the patient with acid reflux can present with chronic cough, especially cough at night time. Patient can present with hoarseness of voice, and there is evidence that this acid reflux can lead to asthma also.
Right,
So
doctor.
yeah.
Uh,
So how can we like next second question is alcoholic liver disease. When does a patient presents with alcoholic liver disease? So here until the liver has damaged to a significant extent, there will be no symptoms of alcoholic liver disease. So it for example, the person might be taking alcohol for last 5 to 10 years, and he might think that so I don't have any symptoms, so there is no liver damage. It's a wrong concept. So the alcohol will be damaging the liver slowly, and liver is such a great organ. It tries to compensate for the damage till the last stage. But once the damage is so much that it cannot compensate, then patient starts having symptoms until will be at a late stage where he needs very advanced treatment for its treatment. The symptoms would be like jaundice, increasing abdominal girth due to accumulation of liquid within the abdomen, or any bleeding from the stomach, or in the black colored stool. So the thing is, anyone who is consuming alcohol, they should not assume that until I have symptoms, I don't have disease. The disease might be sitting silent in the body.
Yes, doctor. Mr. Ramkrishan Karan also wants to know one more question and query he has, is that if the same patient has diabetes, then are there chances of the acid reflux and what other symptoms could he possibly
Yeah.
have gastro related?
So diabetes now on a rising trend in India, and it is now the India is world diabetes capital. So here, the diabetes, if it is well controlled with the drugs, then patient will be not be having any many symptoms. Especially with uncontrolled diabetes, the patient will be having symptoms of gastrointestinal disease. This is reason because diabetes can cause neuropathy, affect the nervous system supplying the digestive system, leading to symptoms like there will be decreased motility of the stomach, leading to increase like delayed emptying of the food from the stomach into the intestine. It is called gastroparesis. So patient will be having sensation of abdominal bloating, early satiety, intermittent vomitings. So, and second is because this can affect the large colon also. Patient there is decreased motility of large bowel. The patient will not be able to pass stool easily, and patient may complain of constipation. And third, the diabetes can affect liver. Now, this is an emerging disease of liver, that is the fatty liver. It is a part of metabolic syndrome. Diabetes and fatty liver is also part of metabolic syndrome. And now we are seeing cases who who is a diabetic and they first present with advanced liver disease. So this is the reason would be fatty liver. So these are the different gastrointestinal diseases associated with diabetes.
Right, doctor. My next question to you is, can painkillers cause ulcers? How do you define ulcers and why are they caused?
Yeah. So people assume that painkillers are safe, but there are many side effects of painkillers. Like it can affect digestive system, it can affect kidneys, and also sometimes it may be associated with heart problems also. But coming to painkillers affecting the digestive system, especially the it's so-called NSAIDs, that is non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, etc. These cause ulcers in the gastrointestinal tract. They cause ulcers in the digestive system. These ulcers can cause pain, they can bleed, and they can lead to sometimes they can cause narrowing of the small bowel also. These ulcers may not heal and they develop narrowing of the small bowel, and they can cause intestinal obstruction. So, unless there is clear indication of analgesics, one has to avoid analgesics, and especially if they are using it long run, they the usage has to be kept to a minimum, and if there is a need for long term, then they can look for alternative analgesics like low dose opioids or paracetamol, etc.
Yes, doctor. Could you please explain now to all of the people watching and all the viewers what is fatty liver and how common is it? And do we suspect the presence of fatty liver? If so, how?
Fatty liver is accumulation of fat within the liver. This is called fatty liver. So, how there are many causes. The most common cause is because of obesity related factors. So, second, there are patient can have history of alcohol consumption, and alcohol consumption can lead to fatty liver. Sometimes viral infection of liver like chronic hepatitis C can cause fatty liver, and sometimes drugs can cause fatty liver. But what I want to stress today is non-alcoholic fatty liver disease. So this is the term where patient will not be consuming alcohol and there is no viral infection of liver. He is not on any drugs, but still the patient will be having fatty liver. So what's the importance of this fatty liver? See, the fatty liver can silently damage your liver over a long run, like 10 to 20 years. It can significantly damage the liver. For example, if you have 100 patients with fatty liver, around 20 to 30% can have significant liver damage in them because of this fatty liver. So, is it common? Yes, very common. A study was conducted in AIMS where they have evaluated the prevalence of fatty liver in urban and rural areas near to Delhi. And astonishingly, nearly 40% of patients in both rural areas and urban areas are found to have fatty liver. And even children, they are having a fatty liver with rising obesity patterns in children. Even fatty liver is becoming common in children in around 20 to 30% cases. So it is quite common. And now the most common cause of significant liver damage once upon previously it used to be viral hepatitis, alcoholic liver disease, and in future, in coming 1 decade, the fatty liver is going to be the number one cause of significant liver damage. So one has to know whether he's having fatty liver or not. So now the question will be, how can I know whether I have fatty liver or not? So there's nothing that, like, there's no need to everyone rush to a ultrasound center, get a screening done. The most important is the healthy lifestyle. Maintaining a healthy lifestyle will keep you away from most of the gastrointestinal diseases. Like, for example, when do you need for fatty liver? If you have obesity, how do you, second, if you have diabetes, so these two are the most important thing. Or if you are hypertensive, if you have any bad cholesterol in your blood, so these are the causes where these people have to be evaluated fatty liver with an basic ultrasound. If ultrasound is showing fatty liver, so then you need to get your blood test done for liver function. How is the liver function? It is called liver function test. There, if there is any abnormality, then you should definitely meet a gastroenterologist or hepatologist to get evaluated for your severity of fatty liver disease. Is there any other causes of fatty liver and how can it be treated?
Yes, doctor. Very well said. Could you also tell us now what is ulcerative colitis and why is it caused?
Okay. So usually the intestine will not be will be a healthy intestine. It will be entire intestine will be lined by smooth layer. So there can be ulcers in the smooth layer of intestine leading to bleeding or increased diarrhea or etc. The ulcers can be due to many causes. Like there can be infection, simple bacterial infection, simple viral infections, which can cause these ulcers. But in some cases, your own body, it is called autoimmune disorders, where your own body cells will try to damage the intestine. Here in ulcerative colitis, your own body cells will try to damage the intestinal lining of the large bowel, large intestine. This leads to ulcers in the large intestine, leading to bleeding, bloody diarrhea, etc. So, in such cases, you need to definitely meet a gastroenterologist. There are very good drugs available to keep it under control, and if you are treated adequately with for this ulcerative qualities, it will be well controlled, and you can have a near normal life.
Absolutely. Another question coming to us from YouTube, and this time it comes from Dehradun. Nisha calls us and writes to us. She says, "Tell us about the causes of diarrhea and jaundice, and why is it so prevalent?"
So, coming, let's first discuss about diarrhea. What is diarrhea? So, diarrhea is any increase in stool frequency or your stool consistency becomes loose compared to previous your stool consistency. So, what are the causes for diarrhea? So, the most common causes one has to know, especially in our developing countries and tropical countries, are infective causes. So, among infection, the most common is viral. There are enteroviruses, adenoviruses, then cause diarrhea. And second common is bacterial infections like E. coli, Shigella, Salmonella, etc. So, so how do you know? So, should we evaluate every patient with diarrhea for what is the cause? No need. So, first of all, when a patient has diarrhea, if there is no blood in stool, if there is no significant pain abdomen, just patient should start taking ORS solution. One ORS packet in 1 liter of water and take, because during diarrhea patient will be losing a lot of salts, different salts like sodium, potassium in their stool. So because of this patient will be having weakness. So then start ORS solution, take it adequately, like for example every 1 to 2 glasses of ORS solution after passing every stool, and wait for 1 to 2 days, because majority of the most common cause of diarrhea is viral infection and they resolve by themselves. If patient have any fever and any significant pain abdomen or any like persistent diarrhea for more than few days, then they can consult the nearby physician for its management. And coming to second is jaundice. In India, most common cause of jaundice is viral hepatitis, infection of the liver by virus. They are hepatitis A, hepatitis E, hepatitis B, and sometimes hepatitis C. So there are other rare causes, like patient will be having gallstones disease. So when the gallstone pass out into the bile duct, it obstructs the flow of bile from gallbladder into intestine, and it can cause jaundice. And in rarely in elderly, when a patient elderly male or female develops a new onset jaundice, then it can be due to malignancy also, cancer also. So they have to be vigilant. So any case of jaundice, never neglect. Immediately reach out to your nearest physician for evaluation.
Right, doctor. Another important question that is coming to us is, how do you diagnose gastrointestinal cancer? What are the signs and what is the treatment, sir?
Okay. So there are like every part of the digestive system can be affected by cancer. So, for example, there is a different scenario is different in the Western countries, developed countries like Europe, USA, compared to India. In India, for coming to first is colon cancer, quite common in Western countries, because of which they undergo screening colonoscopy. Like they undergo colonoscopy every 10 years to screen for any cancer. So, cancer, gastric cancer, colon cancer is not as much common as in Western countries, but still it can. They we see those cases, and usually these patients can present with pain abdomen, any blood in vomitus, any blood in stool, any black colored stool, involuntary weight loss, loss of appetite, intestinal obstruction, etc. And there can be cancers of the gallbladder and can be cancers of liver also. Cancers of gallbladder, they present with pain and jaundice. Cancers of liver, usually cancer of liver occurs at only in those cases with advanced liver disease. So usually these will be having the symptoms of advanced liver disease like jaundice, any bleeding from gastrointestinal tract, or increasing abdominal distension, etc. So the common question one asks is, should we screen for gastrointestinal cancers? There is no evidence from India where we advise screening for gastrointestinal cancers like colon screening in Western countries. But there are few things to be remembered. One, if a patient has any history of familial cancer, any gastrointestinal familial cancer, then they needs to undergo screening for that cancer. Second, if a patient has any history of cirrhosis, that is significant liver damage, those patients have to be closely monitored every 6 months for any new onset cancer in the liver. Otherwise, we don't routinely screen the healthy patient, healthy people for any cancer.
Right, doctor. The next question that is coming to us is laparoscopic surgery better than open, and what is the difference between the two? If you could kindly explain this.
Okay. So, open surgery, as everyone knows, there will a cut will be given in the over the abdominal wall. Then the surgeons go in, do the surgery required, then come out. So here there will be a big incision over the abdomen, and second laparoscopy. Like endoscopy, here laparoscopy there will be a tube-like structure, and there will be a small, the only a minimal small opening is made in the abdomen through which this tube is placed, the laparoscope, and such 2 to 3 entrances are made over the abdomen, and your scopes are inserted, and they do the surgery. So because there is no large cut, the patients can recover early within few days. Usually, with as can be, it can be as early as 24 hours, and also the vision will be better. Both laparoscopy and open surgery have their own advantages, but if both are acceptable, then laparoscopy can lead to early recovery.
Right, doctor. If you can now tell us a little about hepatitis A, B, and C, and what is the method of prevention, since it is very, very
Okay.
prevalent.
Yeah. So hepatitis A, B, C, D, E. There are five important viruses that can affect the liver. D is very uncommon in India. So let's talk about A, B, C, and E. So here hepatitis A and E. These two are transmitted through contaminated water, contaminated food, commonest route of transmission. So these patients usually initially they develop a time of Sprout syndrome, prodrome, where patient will having fever for few days, myalgia, nausea, loss of appetite, etc. Then it is followed by jaundice. The good thing is majority of the people, more than 90%, recover gradually. The jaundice also get resolved, and there will be no persistence of infection within the body once the patient recovers. So, but rarely these patients can develop acute liver failure. Like the liver gets so damaged that patient cannot recover from that, and these patients who don't recover from acute liver failure needs liver transplantation. Second, chronic hepatitis B and hepatitis C. These are transmitted through blood. So, what we see is mother to child transmission, or in any history of like inappropriate in unhygienic needle usages, syringes, etc., can lead to this viral hepatitis B or viral hepatitis C. So these once enter the body, they stay within the body. So they like hepatitis B in nearly majority of the times in hepatitis B and hepatitis C, once they enter the body, they leads to a long chronic illnesses of the liver. Initially, they don't cause any problem, though sometimes hepatitis B can cause, but they stay in the liver. Unlike fatty liver, they damage the liver, and once it liver is significantly damaged, only patient can find the symptoms.
Right,
So,
doctor?
can we prevent these? Hepatitis A, E can be prevented by maintaining hygienic conditions like cleaning your hand, like have taking hygienic food and water. And hepatitis B can be prevented by vaccination. So proper now it is universal vaccination is available for hepatitis B, and hepatitis C we don't have a vaccine, but you need to take care to avoid any IV drug abuse, etc.
And right, doctor. And with this, I'd like to thank you for joining us today and sharing your very, very valuable thoughts. And on this note, I'd like to thank our viewers also and keep the mask up. Keep watching India Science. With this is a wrap on this edition. We'll be back with more interesting episodes next week. Until then, stay safe. Thank you for watching India Science. Mask up and namaskar.